Hi there.
Hi.
My name is Brooke Brown. I am a PA student working with Dr. Carlson today. What's your name?
Stephanie.
Stephanie. Just to let you know, Stephanie, my pronouns are she, her. Do you have any preferred pronouns?
The same.
Same, okay. Well, today we're going to be doing a full, not a full neuro exam. We're going to do a few neuro exams, testing your cranial nerves and some motor skills as well. Does that sound okay?
Yeah.
Okay. So first off, I'm going to be starting off with your olfactory nerve. That is your cranial nerve 1. Okay. So what I'm going to have you do, I'm going to have you close your nostril and blow out, making sure that it's not occluded at all. All right. All clear. Great. So now what I'm going to have you do is close your eyes, and I'm going to have you press against one nostril again. Okay. All right. And let me know what the smell is.
Ooh, vanilla.
Vanilla. Okay, let's do your other nostril. What's that smell?
Vanilla.
All right, still vanilla. Great. So that is good. Now we're going to be moving on to your visual nerve. So that's cranial nerve 2. Okay. So I have this little eye chart for you.
Okay.
So what I'm going to have you do is kind of place it arm's length away and read the smallest line that you can. Okay.
Sounds good. Let's see here. Probably the second one from the bottom.
Okay.
6, 8, 3, 2, 7, 9.
Great. And now I'm going to have you cover up one eye and do it.
Okay. Once again, same line. Looks like 6, 8, 3, 2, 7, 9.
All right, and then switch eyes. You can adjust here for a second. Yeah.
I think the third one up now. Holy. 5, 6, 3, 2, 9, 7.
Great. And do you have contacts at all?
I do.
All right, I will make a note of that. Right now I would be doing a fundoscope exam, but I need to do a little bit further training on that, so we're just going to skip past that for now. Okay. So we're going to move into cranial nerve 3. This is me looking at your eyelid position, making sure that your eyelids cover a little bit over your iris. Everything looks great. Now we're going to do some eye tests. Looking at your pupil size with this light here, I'm just going to put it in the corner eye, have you look straight past me, okay? All right, let's see, here we go. Very nice. I'm going to do the same side over here. Very good. All right. Making sure your pupils are reactive, looking at your direct and consensual eye movement, okay? So basically looking at the opposite eye, that was your consensual movement, and your direct eye as well, making sure that pupil is reactive, okay? I gotta figure that out. All right, so now I'm going to check your peripheral vision. I'm gonna pretend like there's a fishbowl around your head, okay? So let me know when I'm gonna hold some fingers and wiggle them. Let me know when you can see them, okay?
Okay.
All right.
Yes. Yep. 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 And yep.
Okay. Great. So that's good. Next thing I want you to do is I'm going to have my pen here, and I want you to keep an eye on it. I'm going to bring it closer to you, okay?
Okay.
All right. Great. One more time. Cool. All right. So that was your cranial nerve 3. Now we're going to go into 3, 4, and 6, okay? So this is just looking at your ocular field, using your extraocular muscles. And so I just want you to follow my finger, okay? And keep your head still, just with your eyes. Great. Good. All right. Next thing I want to do is chest test. Sorry, excuse me. Cranial nerve 5. So it's your. It involves your jaw muscles. Okay. I'm just going to place my hand right here, and I'll have you open. All right, and clench. Great. And then I want you to do lateral movement with your jaw. Yeah, side to side. Great. Okay. Next thing I want you to do is I'm going to have this sharp Q-tip here. Okay, if I can see your hand. You can see that that's sharp.
Yep.
and that's dull,
Okay.
right? So I want you to remember sharp and dull, and I'm gonna point at different places on your face, and I want you to tell me if you feel sharp or dull,
Okay.
okay? So I'll have you close your eyes.
Sharp. Dull. Sharp. Sharp. Dull. Dull. Sharp. Dull. Sharp. Dull. Dull. Sharp.
Great, all right. Next thing we're gonna move on to is, I just wanted to kind of clarify there. If I saw anything abnormal with that sharp dull test, I would use hot cold. If there were any abnormalities, just to see if you could tell that difference as well.
Okay.
Okay, but everything was good, so you don't have to do it. Next thing I want to do is your cranial nerve 5 and 7. So you said you had contacts, so we're not going to do this today, but I would have you take your contacts out. I'm going to make a little wisp here with my cotton ball, and I'm just going to drag along the side of your eye, just testing that reflex, okay? All right, we're just going to motion through it. It'd be something like that, okay? And I do that bilaterally. Okay. Now testing cranial nerve 7, looking at your facial symmetry. I'm going to have you just kind of follow me, show your teeth. And I'm going to have you blow out your cheeks. Great. Wrinkle your forehead. Great. Now I'm going to have you close your eyes real tight, and I'm going to ask you to try and not let me open them.
Okay.
Okay? Great. All right. Next thing I want you to do is tense your neck muscles. Great. All right. Now we're going to test nerve 8.
Okay.
I'm just going to whisper in your ear. I'm going to have you plug one ear at the same time. Okay?
Baseball.
Great. And I do that bilaterally.
Okay.
Now we're going to be doing the Weber test. So I have my little tuning fork here with me. So I'm just going to ask you when you can hear it, and let me know when you can stop hearing it. So say when you can hear it, and say when you stop hearing it, okay?
Okay.
All right. So I'm going to hit this.
I can hear it.
Okay. Oh.
Okay, I can hear it.
Okay.
I can hear it.
Okay.
Okay, I can hear it.
All right. Great. Well, I was just noting the amount of time between each place that I did it, making sure that there were no difference, or just kind of seeing how long it took you to hear that sound, okay?
Okay.
Next, we're going to do the Brine test. So this is with the tuning fork again, and it's just going to be placed on the back of your ear, okay? Oops, I got to do it again.
I can hear it. There's something here.
Great. I do that wrong. Okay, so now I'm going to ask you, just in one sentence, describe your day today.
It was long, but it was good.
Good. Okay, so I was just looking at cranial nerve 9 to 10, the testing your hoarseness of your voice. Everything sounded smooth and clear. Having any trouble with hoarseness at all?
No.
Okay. Next, I would do your gag reflex, but we're just not going to do that today. But I would have asked you to open your mouth and say ah and yawn. Okay, just checking that movement back there, making sure everything's okay.
Okay.
Now we're gonna test cranial nerve 11. I'm just gonna place my head on your hands again, and then we're gonna do some resistive motions, okay? Okay. So I'll have you turn your head to the left.
Oh, wait, this way, right?
Yeah. And to the right. Great. All right. Now I'm gonna move to your back and assess your shoulders and your trapezius, looking for any atrophy, and I'm going to have you shrug your shoulders up. All right, great. Perfect. Now I'm going to be looking at cranial nerve 11. So that is your tongue. I'm going to have you stick your tongue out at me. Great. And you can go to the side and the other side. Perfect. Just looking for any atrophy or making sure that it's symmetric with those side-to-side movements.
Okay.
All right, we are now into the motor aspect of our evaluation here. So we're done with the cranial nerves.
Okay.
So I'm just kind of taking a look back at you and at your body and your muscle groups, noticing the size, any differences there, or if you have any tics or tremors, which I don't notice any. So everything looks good. Now I'm going to kind of test the muscle tone of your upper and lower extremities, just kind of make a quick assessment, do some range of motion if that's okay with you. And I'm going to do this passively, so I'll just do it myself, okay?
Yep.
All right. Right. Back. All right. No pain with those?
Nope.
Great. Good. And I would do that bilaterally. Okay. Now I want to take a look at your hands here. Not noting any atrophy in your wrists. Great. Now we're going to test your grip strength, okay?
Okay.
So I'm going to hold my fingers out and have you squeeze. Great. All right. Now I'm going to have you take your fingers and go like this, and I'm going to have you spread them out to abduct. All right. Good job. And then your thumb in opposition, so I'm going to have you try and bring it to your pinky, but I'm going to try and resist you. Ready? Go. Great. I would do those all bilaterally.
Okay.
Now I'm going to have you get up on the table here. Clean it off for you.
It's still there.
Okay, so you can go ahead and lay down.
Okay.
Perfect. Now I'm just going to test your flexion of your hip, okay? So yeah, we'll just bring it on up. Great. I'm going to do a few range of motion here. If you can let your leg go in. Thank you. All right. Great. Any pain with these at all?
Nope.
Cool. Sorry, there's a chair there. Then we're gonna, now we're gonna test your hip flexion with resistance. So I'm gonna have you bring your leg up to 90 degrees. Yep, and push against me. Good. All right. And then you can bring it up again. We're gonna go out to the side. Perfect. And in. Great. All right. No pain with those at all?
Nope.
Cool. All right, now I'm going to have you sit back up again, and we're going to test your knees.
Okay.
All right. So I'm just going to sit right here, and I'm going to assess your passive range of motion here, flexion, extension, any rotation. Great. No pain at all in your knees. So I'm going to have you kick your foot out to me, all right, and kick it back. Great. Then we're going to do plantar and dorsal flexion. So this is dorsal flexion, this is plantar flexion, okay?
Okay.
So I'm going to have you do plantar flexion and dorsal flexion. And any pain with that at all?
No.
Okay. So that concludes our motor exam as well. So that's all I needed to get from you today. Do you have any
Awesome.
questions for me at all?
No, I don't think so.
Great.
Thank you.
Yep.